Good afternoon, everyone. Welcome. Welcome to NASCA's National Webinar Series. So glad you can be with us today. As you're dialing in, please take a moment to rename yourself, put your name in your agency, state, or your company so that we know who is with us today. We're thrilled to have you for today's conversation, talking a little bit about diversity, equity, and inclusion in the state workforce. Again, as you're dialing in, please let us know that you're here. Drop a hello in the chat box. You can drop your LinkedIn information in the chat if you'd like to connect with NASCA or each other. And again, welcome to today's national webinar. We're going to get started in just a moment. We'll let a few more folks join us. Thank you so much. Hi, Mary Jane. Hope things are well in West Virginia. Again, thank you all for joining us. Just drop a real quick note to your colleagues in the chat, say hello. And again, this is NASCA's National Webinar Series. We are thrilled to have our panelists with us here today. Today, we're going to talk about the post-pandemic workplace, talking about increasing diversity, equity, and inclusion in the state workforce. We're going to talk a little bit about how we are ensuring usability and accessibility for people with disabilities, along with DEI and hiring practices. I'm Pam Goins, Executive Director here at NASCA. We're thrilled again to have you here with us. This is our national webinar series where we broadcast information and thought leadership to all of NASCA's members. So again, welcome to today's event. Today, we're hosted by NASCA's Diversity, Equity, and Inclusion Professional Forum, a group of colleagues who come together on a routine basis to discuss DEI issues in the states. We're pleased today to partner with the State Exchange on Employment and Disability, or SEED. For today's event, we're going to raise awareness around increasing DEI in the state workforce. Today, we're going to talk about embedding DEI when returning to the workplace, as well as in hiring practices for state government. Drop your questions that you might have in the Q&A box, and we'll be monitoring those throughout today's event. But before we begin, we want to gauge what's happening in the states. We've got 4 brief polls, but we would love for you to respond to them. So Kayla, can you bring up our first poll for us today? So before the pandemic, and prior to things going a little bit crazy last March of 2020, were you aware of your agency or department's health and safety plans? Simple yes, no answer. Take just a second and respond to that question. Again, this is prior to March of 2020. Were you aware of your agency or department's health and safety plans? We'll give you just a few more seconds to respond. All right, and our poll results, pretty equal, pretty close on those who were aware and those who were not. All right, our second poll question. We're going to take this up in time just a little bit. Now that we're starting to return to the workplace, have you been provided with your agency or department's revised or adapted health and safety plans? Again, this is post-pandemic. This is thinking about returning to the workplace. This is considering those in a remote or a hybrid work environment. Have you been provided with an adapted or revised set of health and safety plans? All right, we'll give you just a few more seconds and our results. All right, heavy on yes, that we have seen those newly adapted plans. All right, third question. Do those plans that you have seen have specific language around accommodations for people with disabilities? Think back on those plans that you've seen. You say that you have been made aware of those new plans since the pandemic. Are you aware of language specifically talking about people with disabilities? Perhaps it's around inclusion, perhaps it's around usability, perhaps it's around devices, technology. Share if you're aware of specific language for people with disabilities. All right, pretty close so far. We'll give you just another second or two. All right, Kayla, how do our results look? Split 50-50. yes to no. All right, last poll question before we get started this afternoon. Now we're going to talk about telework policies in your state. Would you say that people with disabilities are given, first response, an effective and meaningful opportunity to participate in telework programs? Second option would be some modification to complete their job, or the third option, little to no inclusion and accessibility opportunities. Again, specifically thinking about your telework policies in your state, how would you respond to this poll question? All right, see several responses still coming in. Pretty even so far. Responses. Well, let's say responses in the results. Okay, 50% said that they have been aware of effective and meaningful opportunity, but that leaves a lot who perhaps aren't being given that. All right, well, I'm excited to get into our conversation today, talking a little bit about just what we've been addressing here around health and safety plans and hiring practices, specifically for people with disabilities, and how you embed diversity, equity, and inclusion in those policies and practices. I'm thrilled to have three outstanding panelists with us here today. Let me introduce to you Bobby Silverstein. He is the Legislative and Policy Counsel for SEED, and also a principal with Powers, Pyles, Sutter, and Verville PC. We also have Amy Perron. She's a program coordinator at the Minnesota STAR program at the Minnesota Department of Administration. And then our third panelist today, Josh Cunningham. He's a project manager of employment, labor, and retirement for the National Conference of State Legislatures, or NCSL. So to our three panelists, let's start out just thinking about those poll results that we just saw. Let me start off with you. What stood out to you in those results? Bobby, are you with us? All right, Bobby looks like he's a little bit frozen on my side. So Josh, let me jump over to you. What were your initial reactions to our poll results today?
I mean, I guess it's not overly surprising. I think that what we typically see is that there's a big variation across states of how workers and employees with disabilities are planned for and accommodated. I think that, one other thing that maybe stands out is just that, there's more to, and we'll get into this more, I think, as we go on, but there's more to telework itself in accommodation, but there's a lot more to it than just you get to work from home. There's a lot of pieces to that as far as making it accessible and usable for those with disabilities.
Perfect, exactly. Amy, from a state perspective, was there anything particular that jumped out to you from our initial polls?
Well, I guess the one thing that I noticed was it seemed things maybe have improved a little bit. The first question was prior to the pandemic, and then the second question refers to now after the pandemic. So hopefully we've learned that this is something that needs to be on our radar and be proactive in the future.
Absolutely. Well, I'm excited about where we're going to go today with the conversation and really give not only some foundational conversation, but also just some practice, some implications that we can share with state colleagues and those here on the phone. It looks like Bobby has had a little bit of trouble getting back in, so we'll give him just a second to log back in as a panelist. So Amy, let me start with you if you don't mind. In Minnesota, you oversee the Centralized Accommodation Fund and the Lending Library. First of all, can you share with your colleagues a little bit about what that means, what your role really entails, and then tell us a little bit about what Minnesota is doing to ensure that the employees have the devices that they need, whether they're in an office or they're in a remote situation.
Thank you, Pam. So really, these are two separate programs that you mentioned. The Centralized Accommodation Fund is a state-run program, and it's available for state agency employees who are within the executive branch agencies. Basically, what happens is if there is an employee of one of these agencies that needs a reasonable accommodation, their agency can submit to be reimbursed for partial reimbursement for the expenses that they have incurred. The state lending library, though, is a separate program. It's a federally funded program. Every state has the AT Act program, and most of us have a lending library where individuals can borrow devices. So the two programs are really complementing each other nicely, where state employees or their supervisors can reach out to us directly to try out devices to see if this is something that can help them to do their job more effectively and independently. It's worked out really well.
And I know you said that one's a state program, one's more federally supported. Can you share a little bit more about really where those funds come through? They are run through the Department of Administration there in Minnesota, but share a little bit more with your colleagues about how those two processes are actually implemented.
Okay, so the federal program comes from the ACL within the federal government, Department of Human Services, I believe it is. And we manage that under, it's called the Minnesota STAR program. As I mentioned, each state has something similar. The Centralized Accommodation Fund is funding that comes through our general fund. And really the way employees or agencies get to know about this program is just word of mouth throughout state government. And we've got a website that agencies can go to and learn more about the program. We also do a lot of presentations and speaking to ADA members, supervisors, employees, just try to get the word out to let people know about the funding options. But more importantly, we're also working really hard to let Minnesota residents know about the opportunity to borrow these devices to learn what really works for them and helps them do the things that they need to do. Today we're talking about employment, but we're also working with individuals in their daily living and daily needs.
Yeah, perfect. So I know those are probably two separate processes, but when you're thinking about Minnesota employees, how are you communicating that these services are available, that these devices are really at their whim if they want to try those out or use those in a remote situation? What's your communication system look like?
So we have a state-run ADA program basically where there's ADA coordinators, HR directors, supervisors. There's all different sorts of listservs and teams that meet on a monthly basis. So we're constantly in communication with them. We let them know about the different opportunities that are available. We also work with all the different state communication teams. We try to get get mentioned in their monthly newsletters and let them know about these different opportunities. Once individuals are registered, so we have one person from each agency who is an approved submitter for the accommodation fund. We build a relationship with them. We send out periodic announcements about deadlines. Individuals are able to submit reimbursement requests on a quarterly basis. So we try to remind them of upcoming deadlines, make sure that they know they have an opportunity to submit. We'll also do one-on-one trainings. We do group trainings, things like that, just to make sure that everybody knows what's available and how to access it, answer any questions that individuals may have, just try to make the process as easy as possible so the employee gets the accommodation that they need.
Perfect. That's very, very helpful. So when we're talking about devices, accessible technology we know is vital to the success of people with disabilities. Again, whether they're in an office setting, some hybrid or some remote situation. So Josh, at NCSL, what are you seeing in your role around platforms, usability, accessibility requirements? And also you mentioned the other day when we were talking some concerns with security in the states. What are you seeing at NCSL?
Sure. So, and I kind of mentioned this in the beginning, but there, and it's unfortunate Bobby is having problems because I know he can really illustrate this very effectively. There's accessibility, which we see, particularly when we're talking about kind of use of technological platforms like Zoom and or Microsoft Teams or other platforms that we're now having to use that we weren't necessarily using before. But there's accessibility features built into those, things like voice to text technology, captioning, things like that. But you have that, but there's really also the issue of usability. How do your workers that you are supervising, you are employing, are they able to use the technologies as well? And it's imperative that these platforms are accessible and usable. So can employees navigate through the platform effectively? Can they resolve minor technical problems on their own? Are these features that are built into the platform you're using, are these things that you're looking for when you're evaluating which platforms to use within your states? So I mentioned kind of captioning within, voice to text captioning that a lot of these platforms are adopting. How accurate is that? Is it more effective to have an alternative like human transcriber or a sign language interpreter? Would those be better options to help better serve your staff? And it really ultimately just depends on the specific situation. So, and that's really true for all workplace accommodations. There's not a one size fits all solution. It needs to be tailored to the individual worker needs and their specific job responsibilities. And so, as far as kind of security, I'm not a security expert, but certainly it is part of the conversation. So taking into consideration cybersecurity issues, again, when you're evaluating these platforms, a real key is just talking to the people within your state who are in coordinating amongst those agencies and those individuals who are experts in these different areas and really utilizing and leveraging their expertise to identify the best technology to be using with your staff. And I would quickly plug the Job Accommodation Network, as well, askjan.org, which is a federal program, offers free consultations to employers and employees about workplace accommodations. And so they can be very helpful to you as well as how to resolve specific situations.
Yeah, I appreciate you mentioning Jan. That's a great resource for our states as well. Bobby, it's nice to have you back. Thank you for dialing back in with us. Technologies is great when it works, right?
Ooh,
I know
you froze and it took a while to get back. Sorry.
It's wonderful to have you back. So we were just touching on a little bit about what was happening in Minnesota with Amy, and then Josh was just starting to begin really our conversation around technology. But let's take a step backwards and really set the stage for everyone that's on the call. We do really want to talk a little bit about that foundation again, the definition. So help us, if you will, around the definition of diversity, equity, and inclusion from a disability perspective, and really that true meaning of accessibility and usability and how there may be some overlap. So Bobby, you want to start us off there?
Sure. You're all familiar, given your day-to-day work, with these concepts of diversity, inclusion, equity. I don't know if you're aware that June 25th, just last week, President Biden issued a new executive order called Diversity, Equity, Inclusion, and Accessibility in the Federal Workplace. You may want to check that out because it includes at the beginning a bunch of definitions of those key phrases. So rather than repeat those, Katia will put that in the chat room in terms of the link. From a disability perspective, this is all captured in the phrase universal design. And when we talk about universal design, it's not only in terms of buildings. It is what we do, how we design our programs, our services, our policies, our plans, to make sure that people with varying functional needs, limitations, abilities are addressed from the initial design stages, not as an afterthought, not retrofitting the policy, but at the table, and people with disabilities with varying functional needs, policies that are necessary for them are addressed. In terms of accessibility and usability, let's talk about those terms in the context of the COVID and the pandemic and the need for platforms for virtual to make sure that our websites, our mobile apps, our online systems are accessible to and usable by people with disabilities. And the US Access Board has actually defined those terms. Accessibility, web accessibility, means that people with disabilities can effectively and meaningfully perceive, understand, navigate, and interact with websites. Usability is similar. It's defined as the extent to which a product can be used by specified users to achieve goals effectively, efficiently, and here's the key, with satisfaction in a special context. So there's a very similar, they're similar and overlapping, but the usability is the satisfaction. And that's more of a personal issue.
No, very, very important distinction. And one of the things that our states are having to grapple with right now, Bobby, we'll stay with you, is as they're making some determinations and decisions about returning to the workplace, how do they ensure that not only those policies, but the practices are fully inclusive? So we've got some states who overnight were told you've got to be back in 100%. We've got some states who were doing some type of a hybrid environment. And then some of our states are still remote first and are saying that our state employees are perhaps the last ones to return to the physical office space. So Bobby, again, help us kind of think through how our state government operations teams can be very deliberate and thoughtful when they're implementing those inclusive practices. And then maybe to tag on to that, how should their telework practices and policies be written for that instance?
Sure. The first thing is that there is some incredible guidance by the Equal Employment Opportunity Commission. They update their COVID guidance every 2 or 3 weeks. Most recent one deals with additional issues on vaccination. The OSHA, Occupational Safety and Health Administration, has developed specific guides for health and safety plans that are disability inclusive. That is, they are address the needs of people with disabilities. They're aligned with our civil rights statutes, Americans with Disabilities and others. And of course, you have CDC. So when you look at, and also for your information, the C Project had what we called a COVID-19 collaborative and addressed all of these issues in documents that we can make available to you, Pam, and your organization. They deal with health and safety policy, health and safety plans, vaccinations, mental health issues, and workforce readiness from the perspective of COVID and people with disabilities. So we can make that available. But here's the specific answer to your question. First of all, most plans right now have a section dealing with management strategies, having the plan, who's going to be responsible, feedback. There's also sections dealing with strategies to prevent or reduce transmission. Vaccination, protective physical distancing, isolation, quarantining, etc. But as the poll showed, only 50% saw that the disability component was addressed. That is the civil rights component, the non-discrimination provisions. So it's very important that these plans reference the EEOC, the OSHA guidance, and as well as the CDC, recognizing full well that this guidance to ensure non-discrimination or equity is always consistent with public health policy. So there's no inconsistency. There's no balancing. The civil rights non-discrimination policy is totally consistent with the civil rights policy. And what that means, for example, is reasonable accommodation provisions. It means if you're going to have face coverings, fine. But there may be some who may need an exception. Or if you have deaf folks, you may need to have them clear. Some people may need personal protective equipment that is required, but it may well be that people with disabilities need additional personal protective equipment. The need to educate and train supervisors to understand possible exceptions, possible modifications. And that applies particularly, Pam, to telework. Telework is explicitly recognized as a reasonable accommodation. But if you look at a typical state policy on telework, the first sentence will say, at the discretion of the supervisor, telework can be provided. Well, that is not exactly accurate. It's at the discretion of the supervisor, except if it is determined to be a reasonable accommodation for the person, in which case it's required. And SEED has developed with Council of State Governments a toolkit on accessible telework that we can also make available to you.
Yeah, there's been some amazing resources put out by SEED and all of your partners, so we're excited to share those as well. A couple of things, Bobby, I just want to touch on, and I'm going to ask Amy and Josh to chime in as well. We traditionally, when we think of people with disabilities, we automatically go to a physical condition, but we don't always go to the mental health challenges. And we know the pandemic has only exacerbated the challenges around mental health and wellness for our employees. So I'm curious, are there particular pieces of guidance that states can look to around mental health accommodations? That's one part of the question. And then probably more so for Amy, what are states doing right now to ensure that those accommodations are provided, but also that the staff is aware of what's to be required and is necessary? What are we to be looking for? So Bobby, I'm going to start back with you, and then maybe Amy and Josh, you can chime in on that question as well.
Just quickly, telemental health is becoming a key issue, not just telehealth, but telemental health. And so that is certainly an option to look at. But again, SEED has a whole framework just on the issue of federal and state policy and practice with respect to telemental health and the issue of pandemic going back to the workplace and people with mental health issues.
Amy, how about in Minnesota? What are you all doing around mental health accommodations for your employees?
Well, one thing that really struck me when Bobby was speaking was when he mentioned educate and train supervisors, and I can't agree with him more on that. I think a lot of times it's just that supervisors and they just don't know what they don't know, right? So it's been really nice here in Minnesota. Our agencies have reached out to employees and done a number of surveys, trying to find out what their preferences are, what has worked during the pandemic, working remotely, what has not worked. And we're finding that a lot of the agencies are going to allow individuals to continue to either work a hybrid platform where they come to the office a few days a week, or if some can just show justification why they need to stay remotely, be it a mental health or be it a different type of disability. We're seeing a lot of the agencies accommodating that request. So I think that's really good. Another thing too with our communications is they've done a really nice job letting employees know about the resources that we have available, such as counseling, telehealth counseling for mental health concerns and issues.
Very helpful. Josh, any particular things you're seeing there in NCSL?
I mean, it's definitely an issue that states continue to grapple with. It's challenging. Mental health oftentimes it's typically an invisible, condition that is also, unfortunately, still taboo to talk about, particularly in the workplace. And so it's difficult a lot of times for employees who have mental health challenges to, be open and honest with their supervisor about accommodations that they might need. But there are a lot of resources out there. I think Jan, the Job Accommodation Network, also a great resource that can help identify, specific accommodations that you can make that are related to mental health, whether it's more flexibility in scheduling, ability to have more frequent breaks, or again, access to telehealth, a number of things that employers can look at to help accommodate those mental health needs. But the key component of that is making your workplace environment a place where your workers feel safe to have that conversation with you to begin with.
Critical component, creating the culture that your employees are comfortable at least starting that conversation. So I appreciate that. So let's jump back to Amy. Not giving out any state secrets here, but I understand that you all have had to put your return to the workplace on pause a little bit. Hopefully some things will change here in the next 24 hours or so. And I'll let you share with your colleagues what's happening up north. But if I understand correctly, you all were doing a lot of work and probably are continuing to do a lot of work around return to work, waiting for a budget to be approved. But in the meantime, what are you all doing specifically around people with disabilities? Again, bringing them back into the workplace, and for those that are going to stay remote, what's Minnesota's story and journey in this scenario?
Thanks, Pam. Yes, so I think we're the final state working on a budget approval, and the deadline is June 30th. So we'll know shortly here if there's going to be a shutdown or not. So the plan originally was the majority of the employees were going to be starting to phase back in August/September. But now with prepping for state shutdown, we've paused some of that planning. So we're anticipating there to be a little bit of a delay. But it's interesting because if we do have employees who are going to do a hybrid setup, they're going to need equipment in two places oftentimes, right? So they might need certain software at home and at work, or different types of chairs or seating, things like that. So there's a lot of work going on right now where employees are communicating with their team and their support to find out what they can get. It's so important to remember with any type of accommodation that this is a team approach, it's a team effort, but most importantly, we need to think about the individual with the disability, and it needs to be person-centered. So no decision could be made without that individual. And it's really important for the individual with the disability to speak up for themselves and let them know this is what I need. So I've been really happy with what I've seen so far as agencies really trying to make an effort to supply those employees with the things that they need.
Yeah, that's interesting. I'm curious too, in Minnesota, are you all considering some version of a hybrid workforce so that there will be some working from home and working from the office as well? Will there be some combination of that?
Yes, and actually it's kind of it varies from agency to agency as far as how things are being done, and it depends on what type of work is done. There are a few agencies that are doing strictly in office. There will be no hybrid method, but that's not the norm, I don't believe. I think the majority are really going to give the employees what they're asking for, and if that's a hybrid model, then that is what they're going to give them.
Can I make a quick comment, Pam? Here
Sure, Bobby.
again, just like in telework, we talked about before. It may well be that everybody's back, that's the policy. But it may well be that a person with a disability under the reasonable accommodation rubric may be request and may be granted the accommodation to continue to be working at home via telework. So just want to pull together what we talked about a minute ago. There may be models where everybody's back, but some people with disabilities may still be telework.
Yeah, that's
This is-
vital to remember. Yeah, go ahead, Amy.
This is Amy. Thank you, Bobby, for clarifying that. And, another thing to keep in mind, pre-COVID, we didn't know what we were capable of. If someone had told us pre-COVID that we would be able to basically put the entire state of Minnesota workforce at home and be successful, I'm pretty sure most of us would have doubted that. But we know now today that it has happened, and we need to be more flexible and accommodating for those folks that need to continue with the remote work.
I think the majority of the folks on the call would agree with that very statement. Amy, who knew we could have done this, but had to overnight. Before we jump subjects, I do want to just ask one more question, Amy, of you there in Minnesota. Because it sounds like there could be situations where there could be some remote work. How are you all actually working with the physical condition? So, we're all used to having our own cubicle or our own office with my own chair and my own desk and my own accommodations at my spot. But now many of our states are going to, space optimization, hotel reservation system. If my desk isn't my desk any longer, what's Minnesota thinking about those accommodations for the people with disabilities?
Again, I think it's something that we're still trying to figure out and work out. With the centralized accommodation fund, the expenses are really paid by the individual agency. So an agency may only have 5 or 10 employees. They might be a division of a larger program, say Department of Administration, for example. My program only has 2 employees. If we were to have to pay for an accommodation, that comes out of our budget. So it's really important for the accommodation fund to work with these employees who need the accommodation to help offset some of that expense. Because obviously, if I am someone that has some mobility impairments and I am asked to share a station with someone who has different needs, that may very well not work. So these are things that we're still working out and trying to figure out, as a lot of agencies are decreasing the footprint. They're relocating to different buildings, or they're determining they don't need as much office space. So this is all kind of in the works, and this is why we're not coming back immediately. This is why it's going to take us a few months to figure it out and make sure everyone gets what they need where they need it.
Absolutely. And I know everyone appreciates you all being as deliberate and thoughtful as you are. All right, let's flip our attention just a little bit and talk about hiring practices, and really those states that the steps that our states must take to ensure that everyone is deliberately included. So Bobby, let me pop back over to you. Can you share with our audience how they can implement those practices such as fast track hiring, special appointment list, and then really bolster the use of internships and apprenticeships?
Sure. Typically, as we all know, there could be civil service requirements. There are certain rules and regs for hiring folks. But at the federal level and a number of states, they have developed accepted service hiring authorities, which allow state agencies to hire folks with certain qualifications that are necessary for their job, for sure, but to not go through that typical process. And in some cases, they're hired on a probationary basis, some cases 6 months, some cases a year or 2. And then if things are working out satisfactory, they become part of the regular workforce. If you're looking for examples, Alaska, Illinois, Nevada are very good examples of states that have developed that. Pennsylvania, New Jersey have bills pending to do this. And so this is a way, an alternative way of getting folks in. Based on the research, we know that people, supervisors, hiring officials still have some prejudices, some stereotypes about what people with disabilities can and cannot do, or particular disabilities. The internship, that seeing them, to experiencing, to see what technology can do, is one of the best strategies there is for hiring and providing opportunities for people with disabilities. So whether it's internships or apprenticeships or using the fast track hiring authorities, these are real strategies that make a difference in your hiring and retention of people with disabilities. And again, we have at SEED, we can tell you up to June 27th what states are doing with respect to different strategies. We keep up to date literally every week. And so we could share that as well.
Yeah, and Bobby, are these mostly legislative changes that are occurring, or are these more department or agency level policies that are coming forward?
It depends on what we're talking about. The fast track hiring authority probably is legislative. The internships, there's at the federal levels something called the Workforce Recruitment Program, where you work with universities, find people with disabilities who are pre-qualified based on a review team, and then these folks can have internships. So it really depends on what we're talking about. The accommodations, the internships, the apprenticeships, special appointment lists. Vermont has mandatory interviews. That is done administratively for somebody with a disability who's qualified, minimally qualified. They have to have an interview. That's another example of a policy that has been adopted.
I think that's what our states grapple with too, is, not only does it come through the legislature statutorily or regulatorily, but then how do they put that into practice and implementation at the individual agency level. So Josh, I know communication and accessibility is critical. Another component of that is making sure that we've just got the right information in the hands with everyone, including those with disabilities. So can you talk a little bit about how states can ensure that their communication is coordinated and accessible? Maybe some steps that states can take.
Sure, yeah. So, interagency coordination is really a key component of one of the initial SEED resources we produced called the Work Matters Report, which was a very detailed policy framework for policymakers to look at disability employment issues and challenges and barriers. And again, one of the key components of that was breaking down silos between agencies. And that not only includes services you're providing to the citizens of your state, but also policies within your state government employment systems. So frequent, organized, and intentional communication and collaboration among agency leaders and supervisors. To discuss experiences and best practices related to hiring, retaining, accommodating employees with disabilities. That helps reduce the knowledge gaps and also improve inclusion consistency. So oftentimes we'll see, you'll have some agencies that are doing really well, or some departments that are doing really well, and others that aren't. And so how do states bring those different leaders together to really communicate those best practices? An example is, you can have governors' councils, task forces, management trainings are all options available to states. A lot of these don't necessarily require legislation. They could be organized at a executive level with working with the governor's office. And it's important to really make sure that as you're having those conversations, you are also including people with disabilities, either workers. It might be helpful to bring, external resources and expertise into those conversations, private sector expertise as well, to really help shape and frame your employment and hiring practices to make sure that you're as inclusive as possible. And ultimately, like, don't let those silos get in the way of achieving your inclusion goals.
Yeah, I know too, in some of the resources that NCSL has put out, part of this conversation also is around equipment and components. So can you just quickly touch on how that right equipment is essential? And we've talked about communication, we talked about setup at home, but really, how do we ensure that the employee can be successful in a remote environment or even a hybrid environment, that they do have that suitable arrangement for them?
Ultimately, it's about having the conversation with the worker. It's having a two-way conversation, make sure it's interactive, addressing their specific needs. Ultimately, a lot of these accommodations are relatively inexpensive or even oftentimes free. And so it's about how to identify the needs that a specific worker requires to achieve their job responsibilities, to make sure that you're setting them up for success. And again, it's a two-way conversation that you have with them, and making sure that as a state employer, obviously you have to take into consideration what is reasonable, for your operations as well. And those are, again, just a total conversation, overall conversation that if you're having with those workers who need accommodations or who are requesting an accommodation, oftentimes you can find a solution that really fits the needs of everyone.
And there at NCSL, are you all seeing any particular state programs that are exemplary when it comes to those training components that you just mentioned? Because that has to happen at the supervisory or managerial level, that they do know how to have those conversations. Any exemplary, without necessarily naming states, but programs you'd like to share?
I think we point to Minnesota often, the concept of a kind of centralized accommodation fund that helps relieve the pressure on the smaller programs in particular. It's a central area of expertise that exists within the state that agencies and programs know that they can turn to if they have questions or if they have a specific need that pops up. And again, this isn't always just a new employee. This can be existing employees who suddenly need an accommodation because they have a change in medical status, or something has changed with their own medical condition that changes what their needs are to make sure that they can do their job. And having kind of a centralized area of expertise, from what we've seen, is a really great way to do that. And it also shows a commitment from the state as a whole that the state is investing and is making this a priority.
And Massachusetts is another state that does this as well. And Josh's answer to me is just spot on, is you can't expect every hiring official to know the breadth and depth of accommodations. It's just not possible. But if you have centralized funding and expertise, and you've got a place where people can demo equipment, you're in a much better shape.
Yeah. Well, Amy, the fingers continue to be pointed back in your direction, and what a wonderful example you all have been for the rest of the country. I'm curious though, before we close today, can you share a little bit about how the Minnesota STAR program came to be? Is it funded from the legislature, state budget, along with the federal funds? Any just guidance you can give on the program itself?
So currently the STAR program is 100% federally funded. We're receiving no state dollars. It just so happened that the STAR program was in existence, then the centralized accommodation fund got the funding from the state legislature, and we just happened to manage the accommodation fund. So we thought it just made sense to really highlight the services that we're doing with the federal program. You know, an employee calls in and they've developed a hearing loss, for example, you know, this is not a new employee, let's say. We will have a conversation on the phone. We will do a virtual demonstration. I'll show them different tools that are available. It might be just something as simple as a $40 amplifier. I've got one right now on my desk that I'm shipping out to an employee. She's going to have the opportunity to try these two devices at home with her phone and determine which one's more effective. Then in turn, she'll go to her supervisor and say, I borrowed this device, this is what works. The supervisor can come back to me and then I'll tell them where to buy it. It's just been such a wonderful partnership. Please keep in mind though, that every state and all 6 territories have one of these federal programs. So even if it is not connected with your state government, specifically, it is still a tool that you guys could take advantage of. My email should be shared, I believe, at the end, and I would be happy to connect anyone with their state federal AT Act program.
Very, very critical information. And Amy, thank you for letting us share your details in case folks want to reach out to you. Well, this has been a fascinating conversation today, to say the least, and we've only scratched the surface around including people with disabilities in the entire DEI spectrum. We know now that all of our states are working diligently around diversity, equity, and inclusion, and many of our governors are using this now to say every decision that is being made must be made through a DEI lens, and we're excited to hear that. Before we wrap up today, I want to go back to each of our panelists and ask if you can share some key thoughts, takeaways, little golden nuggets, maybe 2 or 3 things that states can start as soon as they get off the phone today. So Josh, let me start with you.
I think generally, just thinking more big picture, you know, I think it's clear that we've likely experienced a really rapid and permanent shift in just the nature of work as a result of the pandemic. And that's something that I think states need to be very aware of, particularly as you're looking to hire workers. You know, we had a worker shortage before COVID, but it's looking like the shortage is going to be even greater as we emerge from the pandemic. And so I think there's a number of factors that are contributing to this. We saw a sharp increase in retirements. You know, there's a lot of workers who experienced teleworking for the first time and they liked it. Surveys show that, I think it was a SHRM, the Society for Human Resource Management, did a survey earlier this year that showed 35% of workers who teleworked through the pandemic are willing to take a pay cut in order to continue to do so. But on the other hand, there was another 39% who wanted to return to the office. So what this really shows is ultimately allowing flexibility in where your employees perform their work really might be the future of where the workforce is going in the future of the workplace.
Wonderful nuggets. Amy, how about your key thoughts before we leave today?
Take advantage of the experts in your area. You know, keep the lines of communication open. Find your state AT Act program. They can answer your questions. They can show you the tools that are available and make this, you know, a better workplace, work environment for your employees.
Great. Beneficial. All right, Bobby, let's let you wrap us up this afternoon.
First is the phrase universal design needs to be part of our vocabulary. And that means recognizing the full range of folks' functional abilities. Secondly, when we're doing these COVID health and safety return to the workplace plans, people with disabilities, EEO officers, reasonable accommodate ADA coordinators have to be at the table when they're being developed. It can't be an afterthought, it can't be retrofitted. To recognize that these plans need to have reference to the EEOC guidelines to ensure non-discrimination. Go to OSHA, but also recognize this is not a balancing issue. The civil rights laws are totally consistent with the public health. They're designed that way. And at the federal level, we're seeing it in a very few states, Minnesota and a couple of others. The policies are disability inclusive. We need to make sure that that stretches across the country. And the last one is the SEED project. We're here. We don't have an agenda. We have resources. And if you've got any questions on disability inclusion and employment, we'd be glad to help you.
It's great. Thank you so much. And I see that many of the resources have already been dropped in to the chat. Bobby, let me just come back really quickly to you. So SEED itself, is there a main location where any of NASCA members can go and view that, or do you prefer that they go through some of your partners like NCSL, CSG, and others?
Either way, we have Katia Albanese who's listening in. You can contact her, you can contact me directly, you can talk to Josh at NCSL, our partners at CSG, at NGA, Women in Government, or through you, Pam. You're going to be a partner. If they want to contact, they can contact you, and you can put them in touch with us.
Perfect. Yes, we would be thrilled to make that connection and share all of the resources. Again, you'll see already in the chat, several of the resources have been dropped in, but also as a reminder, all of our recordings here at NASCA with accompanying resources go up on our Knowledge Center at nasca.org. That'll be up here in the next 10 days to 14 days. So certainly you can go back, watch this, share this recording with any of your colleagues throughout the state, and you'll have access to all of the resources as well. The Work Matters toolkit that Josh mentioned earlier is a fantastic resource, chock full of information, both from policies and practice, but also some state case examples as well. So we'll make sure that we share those resources. SEED has been in existence now for what, Bobby, 5 or 6 years or so?
6 or 7 years, yeah.
6 or 7 years.
And you have the CSG toolkit for telework.
Yes. Several resources, and we'll make sure that they're all included on NASCA's Knowledge Center as well. But thank you all so much. Thank you to Amy, to Josh, and to Bobby for being here with us today. Thank you to the SEED team, Rachel and Katia, for helping us pull this together. We are thrilled again to share the resources with you. This is just another of our national webinar series here at NASCA. We hope you'll come back and join us. We do monthly events as well. Our next one is coming up on July 14th at 2 p.m. Eastern time. It's all around employee engagement and the experience and critical to what's happening in all of our states as we continue this conversation around returning to the workplace. So again, thank you for joining us here at NASCA. Be on the lookout for some more information and resources from today's event. And thank you again to all of our panelists. We'll talk to you soon.